Our next speaker is Dr. Amelia Woolums from the University of Georgia, and her topic is risk factors for BRD on cow-calf operations.
Thanks very much. Can you all hear me? I want to especially thank Dr. Guterbach for advocating for this session and everyone who was involved in putting it together. And I was at the University of Georgia for about the last 16 years, but many of you know I recently joined Mississippi State University, and it was tough to leave the people at Georgia, but we're doing some really awesome things at Mississippi State, and I'm looking forward to talking to you about that more in the coming years. And so today I'm going to talk about herd-level risk factors for BRD on cow-calf operations. We've had a lot of talk about feedlot BRD this morning, and some mention of how what happens at the cow-calf operation is related to feedlot BRD. I won't get into that in a lot of detail, but there are some interesting things happening on cow-calf operations as well. Just want to mention the support that I received from various sponsors for my BRD research. I'm going to talk about information from a risk factor survey that was specifically funded by Zoetis, and I want to thank them especially for that. So we talk about BRD risk factors. We know generally what they are, but as far as published research, there's quite a bit more published research on risk factors for BRD in dairy calves and in feedlot cattle. And many of you have heard me say that several years ago a group of BRD researchers came here to ABP and had an open forum with attendees and said, hey, what do you want us to work on? What do you think are important issues? And one person said something that really stuck with me, and he said, I would like to know why these calves, when they get sent out to summer pasture with their mothers, get pneumonia. And I thought, wow, beef calves out on pasture with their mothers getting pneumonia? I'd never even really heard about this. And went to the literature, and there really wasn't very much published. And so that led me to get together with some of my colleagues, who you'll hear more about here in a minute, to try to figure out why calves living on pasture with their mother as God intended get pneumonia. And so that's what we're going to talk about. But when the title of my talk was BRD on cow-calf operations, I thought better not forget to talk about the cow. And adult cows can get respiratory disease, but it is not well characterized, especially not in beef cattle. There are NOMS data showing that producers determined that 3.4% of adult cow deaths were due to BRD, and this is of the 1.5% of all cattle that died or were lost. And so a pretty small percent of beef cows appear to die of BRD, but it is out there, and occasionally I'll hear anyway, of outbreaks of BRD in adult cows, and they can be devastating. There's a little bit more information on dairy cows, and just wanted to let you know that there have been some outbreaks described and published, including outbreaks of BRSV in adult dairy cows, where BRSV caused fatal disease in adult dairy cows, or I should say was associated with fatal disease. And it led to respiratory signs, some death and decrease in milk production. Bibersteinia trihalosii, a nice series of cases described by Dr. Cortese, including some involving adult cows. Here is a not too clear picture, but a picture of lung from a cow. This was sent to me by a veterinarian in the field, and this was an adult dairy cow with severe pneumonia that was fatal, and they isolated Mannheimia haemolytica out of this. And so the point of these couple of slides is just that adult cows can die of pneumonia, and you can find the agents that you find in calves and feedlot cattle too. But we don't really know much at all about risk factors. I haven't found any controlled research. Anecdotal reports suggest things like contact with sick calves might put cows at increased risk. And in one of our surveys, we did find that cow-calf operations that treated at least one cow for BRD were more likely to see calves with BRD. New introductions might put the cows at greater risk, and some people have suggested maybe mycotoxins in feed. Don't forget AIP, usually due to pneumotoxins in feeds, can also cause some cow respiratory deaths that may be sometimes called BRD if producers don't know different. So now I'm going to spend the rest of the talk talking about respiratory disease in calves, and specifically preweaning calves on cow-calf operations. I'll sometimes refer to these as nursing calves too. And this is what a lot of people will call summer pneumonia, because that's when calves are preweaning. Calves born in classical spring calving herds are preweaning. So BRD has been reported to be the leading cause of death in calves 3 weeks of age and older. 16% of the deaths of calves that are born alive are attributed to BRD by producers interviewed by the NOMS group. BRD can be a problem for an important proportion of herds. 20% of U.S. producers indicated that nursing calf BRD had been a problem for them in the previous 12 months. I'm going to show you data from several studies, including some of our work, and this 20% of herds seems to come up over and over again. So I think 1 in 5 herds perceiving a problem with preweaning BRD is probably a good number to have in your head. Here are some data from the MARC herd, and many or maybe all of you know that the Meat Animal Research Center has a large, actually several what you might call herds, and do a lot of good work with those cattle. And in a study, they reported pre-weaning calf BRD in that herd. They had data from over 110,000 calves over 20 years. And so the annual incidence over these 20 years ranged from 3% to 24%, with a mean of 11%. So on average, about 11% of the calves were treated for BRD. The annual mortality ranged from 7 to 17%, with a mean of 13. And here's a graph that I often like to show. And so basically, this is the incidence of pre-weaning calf BRD over 20 years in the MARC herd. And you can see here it drops down to as low as 3% up to as high as about 24%. But look at that. I mean, it's like a sine wave, right? And why is that? Up and down. And so I don't know why that is. We don't know for sure why this is, but I think there are different things that you could imagine. But the reason I put this in here is that if you work with producers over several years, you might have a producer that has pretty bad BRD for 2 or 3 years, and then things get better, and you think, okay, well, whatever we did, it took care of it. Well, it might be coming back. So with time, you might see patterns that you don't recognize if you only look for a year or two. So just want to make sure that you see that this has been identified. And then on the MARC herd, this is a graph of age of the calf by number of BRD cases treated. And my colleague, Dr. Dave Smith, one of my most important collaborators on this research, is going to show data more like this that he has collected over several years in his talk this afternoon. So I'm not going to get into this too much, but just note that there are a couple of peaks here, right? Here's a peak where the calves are about 20 to 30 days old, and here's another peak where the calves are about 120 days old. And you can imagine different reasons for this, and Dr. Smith's going to get into that more this afternoon. In the MARC herd, affected calves laid about 13 pounds less at weaning than unaffected calves, so pre-weaning BRD does cause important weight loss. In some years, the incidence of pre-weaning BRD in the MARC herd was higher than post-weaning BRD. So we all know BRD and weaned calves going into the feedlot's important, but in some years they saw more BRD pre-weaning. A little bit more data on the impact. This was from a survey of 332 producers in Canada, and these producers reported that there was the reports of these producers led the investigators to determine that mean mortality due to calf BRD was 13% in herds with less than 40 cows and 18% in herds with over 40 or more cows. This was the percent of all mortality, but the larger herds recognized more mortality due to BRD. The group at Kansas State did an analysis of NOMS data, and this involved 443 herds in 24 states, representing 80% of the U.S. cow-calf population, and they found the mean percent of pre-weaning cows with BRD 3% plus or minus 7%. The rate overall was 1.5 cases per 10,000 calf days, but here the range was 0 to 75 cases per 10,000 calf days, so a wide range in the rate of calf BRD among herds. And so here's a figure that shows that a little more clearly. The distribution of pre-weaning calf BRD rate in 443 U.S. herds. So you can see many of them have 0% calf BRD, so lots of herds that don't recognize any calf BRD at all. But then the rate going up higher and higher, so a few herds with quite a lot of calves with pre-weaning BRD. So the BRD seems to be skewed at the population level, with a few herds having a lot of BRD and many herds not having too much of it. We did a survey by mail of U.S. cow-calf producers in 6 states, 3 in the East and 3 in the West, and we found that 21% of operations reported seeing calves with BRD. Of these, 89% treated at least one calf, 46% reported at least one calf death. Okay, so that was just to give you an overview. Does this really matter? Does preweaning calf respiratory disease matter? And I think it matters quite a lot to some operations. I've talked to other people who say, gosh, we never see that. We don't really think that's a problem. So I think it depends on your experience or your producer's experience. But overall, the literature tells us that about 20% of herds see calves with preweaning BRD. Among affected herds, the proportion of calves affected varies widely. In a given herd, the proportion varies across years. So again, if your preweaning BRD rate drops off, don't think that it's necessarily gone for good. Preweaning mortality attributed to BRD is approximately 15%. Costs associated with preweaning BRD have not been well estimated, but Dr. Smith and his graduate student Min Wang are working on this right now, and he'll talk with you a little bit more about it, but more on that will be coming. So we are trying to get a better handle on this. Our collaborator, Dr. Brad White at Kansas State, is also helping us with doing some estimates of the cost of preweaning BRD. So more soon. All right, so that's the sort of importance. Now on to the risk factors for calves. And we're going to talk first about calf-level risk factors, what makes an individual calf more likely to get BRD compared to that calf's herd mates. And then I'm going to talk a lot more about herd-level risk factors, because that's where I've led some of the research that our group has done. Dr. Smith will talk more about calf-level risk factors this afternoon. But in the data from the Mark herd, the year the calf was born increased its likelihood of having BRD. Well, that makes sense. Some years there was more BRD than others. The location of the group on the operation, and I think this is interesting, and I'd like to look at this more, because I've certainly had people say to me, wow, we've got one pasture where we always seem to see more calf BRD. And I'm not really sure why that is. You could make up a lot of ideas, but I think it's an area that could use a little bit of work. If a calf experienced dystocia that required major assistance, if a calf was a male, and this has been shown in a few studies, and Dr. Smith has some data that he'll show this afternoon, male calves have repeatedly been shown to be more likely to be treated for preweaning BRD than female calves. And in the Mark herd, if the dam was a heifer, the calf was more likely to be treated. Another study done by Dr. Whittam looking at 7 Colorado herds, and they looked at respiratory disease just in the first 45 days of life. So not the entire pre-weaning period in this data set, just the first 45 days of life. And they found that twin calves had their odds of being treated for BRD were about 15 times higher than non-twin calves, so that's not too surprising. Of course, we don't want twins really, so you hope not to see too much of that. And male calves, with male calves being the odds of their being treated for BRD being 3 times greater. Now, on to the studies that have been done of herd-level risk factors. And our group, well, the first data set I'm going to show you is actually the Kansas State group, who looked again at that NOMS data. So this is the same study I mentioned earlier. Here are the factors that they found associated with pre-weaning BRD. So that's something you might wonder, right? If 20% of the herds have it and 80% don't, what's the difference? And what can we do maybe about that to help the 20% not have the problem anymore? So the Kansas State group, looking at the NOMS data, found that the incidence of nursing calf BRD was increased with importing weaned steers. Of course, that's something you can think, well, that makes sense, because that's a good source of possibly bringing in pathogens. Herds that had cattle from 2 or 3 breed crosses or composites were more likely, as compared to purebred herds, to have BRD. If the producer considered the operation the primary source of income, they were more likely to have BRD versus somebody that considered it a hobby or a secondary source of income. If they fed antibiotics to prevent BRD, and some of you may be kind of thinking, well, that's pretty great, you know, we're doing something to prevent it and we're actually causing it. Of course, one thing we always have to remember in surveys is that when we look at a factor, we don't know the time that this factor was introduced relative to the problem that we're looking at. And so we can't say that this was a cause, they were just associated. And herds that had visitors, but it wasn't linear, and it was kind of interesting. I think if I remember it right, it sort of was high in the middle, but not on either end. So if you had a few visitors or a lot of visitors, it wasn't as much a problem as if you had a medium number of visitors. I'm looking for Dr. White. Is that about how you remembered? He's nodding, yes. So it's not like the more visitors you had, the more calves you were going to treat with pre-weaning pneumonia. Then our group did a mail survey of the producers in the 6 states that I mentioned earlier. And when we looked at our data, we looked at factors that were associated in 2 different ways. And I have to give credit to my colleague Roy Burgess, who did the analysis for this. It was his idea, and I think it was a great idea. We first looked at factors that were associated with whether or not the producer reported seeing any calves with BRD. So one of the questions on our surveys was just, did you see any pre-weaning calves, or did you treat any pre-weaning calves? No, we asked, did you see? That's right. Did you see any pre-weaning calves with signs of BRD? And we defined BRD pretty clearly, I hope. And so they said yes or no. And so this list of risk factors is going to be for the herds that said yes versus the herds that said no. Then we asked them if they treated any, and if so, how many they treated. So we also looked at risk factors that were associated with treating more. And if you stop and think about that, if you were a researcher, you have to kind of decide what questions you're going to ask. Do you care about knowing if a herd sees calves with BRD? Or do you care about knowing whether a herd or producer treats calves with BRD, and if they treat a lot of calves with BRD? So we looked at both of those things. And so factors that were associated with the producer seeing calves with BRD, first of all, included herd size. So we used as a basis for comparison whether or not they herds with 1 to 49 calves. So small herds were kind of the standard. If a herd had 100 to 199 cows, the odds ratio was 4.1. That is, the odds of a herd with 100 to 199 cows seeing a calf with BRD were 4 times greater than a herd with 1 to 49 cows. And if it was a herd of 200 or more cows, the odds were 5 times greater. So bigger herds were more likely to see BRD. Now, it may just be that they're more likely to see BRD because they've got more cattle. The more cattle you have, the more likely one's going to get respiratory disease. Or there may be some causative effect here. We don't know for sure. If they had diarrhea in their calves, the odds of them seeing calf BRD was 8.5 times greater. If they treated at least 1 cow for BRD, the odds were 4 times greater. And in the plains herds, if the calving season was 3 months long or greater, the odds were about 1.5 times greater. So these were things that were significantly associated with the herd reporting that they saw calves with pre-weaning BRD. Factors that were associated with an increased proportion of the calves being treated included bringing in calves, orphan or grafted. This was the exact language we used on the survey, trying to get the idea of did they bring in little baby calves, maybe put on a cow that lost their calf. Well, if they did that, the proportion of calves they treated for BRD was 2.6 times higher than herds that didn't do this. If they had more than 50% of their calves born between January and April, so kind of late winter, early spring calving, the proportion of calves treated was about 1.5 times higher. If they gave nursing calves creep feed, the proportion treated was 1.7 times higher. And if they used a heat synchronization program, the proportion treated was 1.6 times higher. Now, so the things I just listed, those are maybe rolling around in your head and you kind of maybe wish you could compare them all in the 2 studies. The group at Kansas State, Dr. Hanzlicek was the first author on the paper, found different risk factors. That was where the producer considering the herd a primary source of income or not, importing weaned steers. They found different factors than we did, but I think the factors in both of our studies point to similar overarching risks. And I would say that those would include large herd size, factors that may allow introduction of new pathogens. So the Kansas State group found importing weaned steers was significantly associated with treatment rate. In the male survey, we found that bringing in orphan or grafted calves was significantly associated with more calves being treated. So those may be getting at sort of similar things. And then also factors that allow increased effective contacts. And an effective contact is when an animal that has an infectious agent it can transmit gets in contact with a susceptible individual. So, and that then leads to transmission of the infectious agent. We speculate that the synchronization that was identified in our survey might be a cause of pre-weaning BRD, or at least is associated with it, because when you synchronize the cows, what do? You pull the calves off the cows, they get put in a little pen, it's like they're at summer camp for a day, and the cows go through, or a few hours at least, the cows go through the chute, and that's going to happen at least 2 or 3, at least 1 or 2 more times, right, for most synchronization protocols. So the calves are stressed, it's a short stress, like Dr. Richardson says, maybe that's not that immunosuppressive, but you're getting a lot of opportunity for effective contacts that you wouldn't have had if they'd all just stayed spread out on the pasture. So the last thing we did was a case control study, and this is a little bit higher quality of information than you get from just a survey. And so we wanted to try to test some of these factors that we found in the survey to see if they also stayed associated with preweaning BRD in a case control study. And so we did phone interviews of producers. We identified producers with case herds, and these were producers that treated at least 5% of their preweaning calves for BRD. And then we selected, using a random approach, control herds from the same veterinary practice. So we basically found herds from the same veterinary practice. We selected them randomly, and these had to be herds that treated no more than 0.5% of their calves for preweaning BRD. So basically we're comparing what herds do if they treat at least 5% of their calves for preweaning BRD to what herds do if they treated less than 0.5% and they were in the same practice area. Does that make sense? We tried to enroll 2 control herds for each case herd, and we enrolled herds in South Dakota, North Dakota, and Nebraska. And part of the reason we limited to this area of the country is that we talked to a lot of people with preweaning BRD. There was a lot of interest on the part of some producers and some veterinarians, and large number herds, large size herds, so it was easy to get the information we needed, relatively speaking. The interviewers were asked questions regarding management and disease in the previous summer. So my students called them in the wintertime, asking them about the previous summer. And they were interviewed in the winter of 2012, 13, and 14. All right, so I'm not going to read all these, but just in case you're wondering, these are the management practices that we ask about. And these are highlighted just so I can see them easily to tell you in case you're wondering. We did ask about things like, did cattle have fence line contact with other herds? Were any cattle brought onto the farm from outside sources? Were respiratory vaccines given to cows and calves? Were any cows or heifers treated for respiratory disease? We ask about other things regarding management, including things like managing them in more than one group, intensive grazing, synchronization, length of calving season, and testing for BVD. All right, so and when our analysis led by Dr. Burgess, he used conditional logistic regression with variables that were associated being retained in the model if they were significant at p less than 0.2. And we ultimately decided that we would consider things significant if they were associated at p less than 0.1. And we left herd size in the model because we thought that might be an important confounding variable. Okay, so we enrolled 84 herds, 30 case herds, and 54 control herds, 29 from Nebraska, 23 from North Dakota, and 32 from South Dakota. Good job, Dr. Daly. And here's some information about our case and control herds. So the number of cows and heifers calving, the median and the range is what's shown here. So the median for the control herds was 173 cows and heifers versus 325 for case herds. So that's a fairly noticeable difference, and that's the biggest difference we found in the things we looked at. The percent of first calf heifers in the herd was 13% for the controls. So these are the herds that didn't treat calves for preweaning BRD or treated no more than 0.5%. And over here are the herds that treated at least 5% of their calves. So percent first calf heifers, 13% versus 15%. Calving season length, I was kind of interested in this, but they look pretty much the same in our case and control herds. Average age of calves at weaning, 183 days versus 180 days, really pretty close. Average weight of calves at weaning, 249 kilograms, so 500 pounds, versus 256 kilograms, so not much difference. So we were actually kind of happy to see this table because it means our cases and our controls are a lot alike in many ways, and so that may mean that they're good to compare. So here's the punchline. In our case control study, the significant risk factors in our multivariable model were the number of cows and heifers calving. So versus herds with less than 150 cows, if they had 150 to 499 cows, the odds were about 8 times greater that they would be a case herd. If they had over 500 or more cows, the odds were about 12 times greater that they would be a case herd. So really see more preweaning BRD in the large herds. If they used intensive grazing versus herds that didn't, the odds that they were a case herd was 3.3, so they were 3.3 times more likely to be a case herd. And if the cows or heifers were synchronized, the odds were about 4.5 times greater that they would be a case herd. And so I was really interested to see this synchronization kind of stick because this was also found in our male survey. And I want to give a shout out to our colleague, Dr. Isaiah Smith, who was a student at Georgia for many years, now a very successful practitioner in West Virginia, and he told me long ago, well, we see a lot of pre-weaning pneumonia in these herds that synchronize. And so this anecdotal report has ended up coming out in the research that we've done. So in conclusion, factors, what's the point? It looks to me like factors that may increase effective contacts between calves may increase the risk of pre-weaning BRD. And these we have found to be, in this case control study, herd size, whether or not they synchronize, and whether or not they use intensive grazing. The next steps will be to test methods to modify these effects to see if we could decrease pre-weaning calf pneumonia in these herds. You know, I don't want to tell somebody, well, don't synchronize, that might lead to pre-weaning pneumonia. Don't intensive graze, that might lead to pre-weaning pneumonia. These are both methods that progressive producers use to improve productivity. So we want to see if we can fix the factors or mitigate the factors that lead to the pre-weaning BRD. Maybe improving calf immunity through early vaccination, maybe decreasing the size of groups when calves are congregated. Those are just a couple of ideas I had. I just want to point out that all this information I've just told you has some limitations. Most of what we know about risk factors is based on antemortem diagnosis by producers. Is producer diagnosis of BRD reliable? We could probably debate that, but here is a little study showing that 16 dairy calves with postmortem pneumonia, the producer correctly identified 9 of them, but they didn't identify any that didn't have pneumonia. And so these investigators came up with a sensitivity of producer diagnosis of calf pneumonia of 56%, specificity of 100%. Many of you know that an estimate for feedlot BRD clinical diagnosis was done by Dr. White and Dr. Renner, and they estimated a sensitivity of 62% and a specificity of 63%. So I just want to put that out there. Everything I just told you is pretty much based on producer diagnosis. We also know most of what we know because of surveys. That may be incomplete. Researchers don't always ask the same questions, but there are some common themes, and I've gone through those, so I don't need to probably emphasize that too much anymore. I think factors that allow introduction of new pathogens, so things that might allow introduction of new pathogens, or things that increase opportunity for effective contact, so things that bring cows and calves close together, might be important factors or appear to be important factors in pre-weaning pneumonia. Remaining questions: what situations are the most important? Does vaccination help? Note that vaccination didn't come up in any of these studies. Does passive antibody have an effect? Dr. Smith will talk about that more today. Other things we might like to know about: genetics, nutrition, and weather, we're trying to learn more about. So, and I've kind of said all this, so I don't need to repeat that. For more information, again, Dr. Smith this afternoon at 4:15. One of our student researchers presented some information yesterday on antibody titers in pre-weaning calves, and another is going to be presenting information on BRD diagnosis. So, thanks very much for your patience.